Okay, so great to have you with us. And this panel we called Women's Health. Whole food plant-based doctors discuss how to prevent and reverse chronic illness, autoimmune disease, arthritis, and other women's health issues. And I think the Real Truth About Health conference has focused a lot about heart disease, diabetes, cancer, Alzheimer's. And I'm 58 years old and my wife is 57. And in the last few years, she's complained to me that there's all these things that are different in her life, physically, emotionally, mentally, sexually. And she feels like, how come no one told her? She feels a little like, why is no one talking about this? Why is no one talking about this? And she feels a little like the things that are happening to her, she feels a little bit isolated, like she didn't know that this was normal. And she's been going to different people, different doctors. And she's starting to now realize, like, wait a minute, this is very common and there's not something wrong with her. Things are changing. And she kind of feels a little like, why haven't I been told exactly what's going to happen? So I hope that to some degree, one of the things we'll accomplish tonight is to just speak to women of all ages, but certainly those in their 30s and 40s, to let them know a little bit more about what it's like, and to women in their 50s and 60s and 70s about the best way to handle this. So I look forward to trying to move forward with this. So I am going to ask you questions, but before we do that, if each of you could just take 30 seconds to tell us your name, your latest book, or if you have one, and just what you've been doing the last 20 years so we can get a little more familiar with you. And I guess we could start with Dr. Goldner and then Dr. Rahman.
Thank you so much. You know, what you just said reminded me of a conversation I had with my best friend in medical school when we both had children. Why didn't we learn anything in medical school about how much breastfeeding hurts, right? She was the lactation consultant for her hospital, and we didn't know that as doctors. We had no idea. We had to learn that ourselves. So I definitely think there is a need for more discussions about what it's like to be a woman that's separate from what we learn. My specialty is more towards actually optimizing your immune health. So for those who didn't see my talk, I'm someone that had, I had lupus nephritis. I had antiphospholipid antibody syndrome, which meant that I had lupus attacking my kidneys, causing blood clots, strokes. I had a very difficult time with my health as I was also becoming a doctor. And 16 years ago, I reversed my disease completely with my nutrition protocol. I saw some shout out to my smoothie shredders. Hey guys, they all know about my nutrition protocol, which actually optimizes cellular function and optimal immune health through an intentional overdose in nutrients that are used by the body for those reasons. And we've been able to replicate those results in thousands of people all over the world. Some are giving me shout outs here, and reverse things like lupus, mixed connective tissue disease, scleroderma, Sjogren's, MS, as well as things like diabetes, high blood pressure, heart disease. So what I really try to do is spend my time educating and inspiring people that it is possible, it is not difficult to do, and that it's important to do. I'm also an expert in trauma and trauma resilience. And so what I try to teach people is that if we do take charge of our emotional health and we feed and nourish our bodies as well as our spirits correctly, then we can have good health and we can have a great life even while we're struggling with our health. And that's really what I try to do. So my most recent book is Goodbye Autoimmune Disease. And in that book, I talk about not just the nutrition for reversing disease, but the mindset and the emotional health necessary to optimize your happiness, which also optimizes your healing.
Thank you.
Hi, everyone. I'm Dr. Rahman, and I'm a board certified OBGYN. And I can so relate to your wife because I think we're sold a false bill of goods. We think that the vital years are in our 20s, and by the time we get in our late 30s and 40s, it's all over. It's all over, menopause, find a corner, and just shrink. And the reality is that women are becoming their most vital and most vibrant at this point in your life. You've experienced things, you know things, and hopefully you have the health to allow you to enjoy life. And so from a gynecology point perspective, I find that the GYN issues start to become prevalent in the 30s, 40s, 50s, and beyond. And so this is the time to optimize your health, not only for midlife, which can be fantastic, but for the years beyond that.
Okay, great. Thank you. Okay, so first question, and I guess you could both answer any question, and you can also pass on it if you feel like it's not something you focus on. But the first question, let's just stay with my wife and I for a moment. So I'm 58, she's 57, and in the last few years, my hormones have changed. I am less hormonal. My sex drive is lower, but it feels appropriate, but clearly lower. And her sex drive at times has dramatically dropped, combined with that sex feels painful and vaginal dryness. And so it's a whole system of a combination of she feels some shame, she feels she's going to disappoint me, she feels a little embarrassed, and she feels like there's something wrong with her. Like she's like, there's something wrong, like she's, and then she whispers to a couple of friends who whisper back really quietly, I'm going through the same thing. My husband and I aren't really having sex. And when we do, it hurts. And it's a little bit of confusion. And I guess I'm concerned that there is like this shame, not that there should be shame, but that she feels like certain shame, like somehow she's a woman, she's supposed to be sexual with her husband, and she's not feeling it. And on the other hand, I feel a responsibility as a husband to be the most supportive I've ever been in the relationship. And even if my sexual desire exists, to be really compassionate for what she's going through. And I could see that a lot of relationships could have a problem, because if a man thinks that he's entitled to sex, which he's not, but if he has that mindset that it's expected, and a woman, and I'm stereotyping that it's the man and woman this way, it could be the reverse, and the woman is feeling like her body's changing and this is not really what she's feeling, this not only does it physically create issues, but the connection, there could be issues between them. So maybe you could help just sort out what I'm saying. Tell me if some of this sounds familiar. What do you think's going on? What wisdom do you have to share? What's normal? And also throw in, what's the best way you think for men to support women if they're changing?
Wow, that's a lot.
Sorry.
That's all you.
Sorry.
That's a lot, because when you talk about sex, that's a hot topic. That's a very hot topic. And the reality is most women don't talk to the gynecologist about sex. And the reality is most gynecologists don't talk to their patients about sex. So it's this thing that never really gets discussed, but everybody wants to talk about it. In terms of your wife, the changes are real. I mean, there are hormonal changes that go along with the perimenopause, menopause. You have declining estrogen levels, and that doesn't go unnoticed. Vaginal dryness can be something that results as a result of the declining estrogen. But there are other things like decreased libido. I just don't have an interest. And so there's multiple factors, and it varies from person to person, couple to couple. You have to find out, is it a physiological issue that you can address? Is it a relationship issue that needs to be addressed? Is it related to life in general? Sometimes life gets so hectic and so stressful that one of the things that's easy to expend, to do without, is sex. You know, you have to pay your bills, you don't have to have sex. I mean, so it becomes something that you're willing to forego. I think the one thing that couples need to be able to do is talk about it, okay? Because you don't know the expectation of your partner unless your partner will speak to you. The other thing is that most women mourn the fact that it's not like it was when I was in my 20s. That's true, but that doesn't mean it can't be wonderful, it can't be fulfilling, it can't be satisfied. I sometimes use the analogy of a fine wine. It's had time to season. There are flavors, there's nuances that you have with your partner, and a certain level of intimacy that is not just about the physicality of the moment. It's about a number of things that come together and form this very rich bouquet. So I think that it is possible to have a wonderful, satisfying, invigorating sex life. It may take some discussion, it may take some vulnerability in that you have to say, I don't feel this, or I would prefer this, and then you go from there.
Okay, thank you. And do you want to just comment one time also about how men should best support women who are going through this? What is the, again, I would hate to, I wouldn't want a man to take it personally that thinks his wife doesn't like him because she's withdrawing or she has a lower interest in sex. I wouldn't want a woman to feel judged because she doesn't want to. How could a man be most supportive to his partner in this situation?
I've heard it both ways. Some women just tolerate it in order to satisfy their partner. Some men lose interest because they have erectile dysfunction or some other problem. I'm saying probably the easiest way to deal with it is to acknowledge that things are different and then look for what brings me pleasure. How can I pleasure you? And then you go from there. And you make it something that's not stressful, but a relief. Because now we're on this new discovery about, does this feel good to you? And if it does, we're going to do more of that. If it doesn't, we're not, or we're going to find another way to make ourselves enjoy each other. And so it's a way to, it's an opportunity actually to rediscover your partner.
What I would add to that also is, I think the way you deal with this issue is how you deal with every issue in a marriage, which is communication, right? I mean, you've got to talk to each other. My husband and I have an amazing marriage, and we talk all the time, every day, every single day, about everything, from how much we love each other to any issues that we have. I mean, it's just a constant flow. And so maybe the issue is going to be sex, but maybe the issue is going to be something else. And if you can't express to your partner when you're uncomfortable, then you've got a bigger problem than sex. You've got a problem with communication. I don't know any sexual partner who would want their partner to participate in pain to please them. I wouldn't find it pleasing to know that my partner was suffering while we had sex. I want, the whole point of sex is communion, not just finishing, but a communion and a sharing of love and pleasure. And so I think we do need to focus on that aspect as well, that if there's an issue here, there's an issue. And if you communicate, I agree with Dr. Rahman that it can still be beautiful, and maybe it will be different, but at least it will be a shared experience, which is what sex is really about, at least with a partner.
The other thing I heard you say is that we don't really know where to go for help. And that's a real issue, because you end up doing things like Googling or reading an article in a magazine and not having the answers that you may be seeking. And that's where you have to be fairly proactive. I mean, just like you would with any other issue. You need to, if it's the female and the problem is vaginal dryness, pain with sex, she needs to see her gynecologist, and she needs to bring up the issue. She needs to speak up for herself. If the issue is libido, you need to talk about that. If it's relationship, you need to talk about that. If it's her partner, sometimes men will not want to own up to the fact that things are different for them too. And so all of these things have to come out. You have to, if it's a priority in your relationship, then you'll seek out the help that you need. you should seek out the help that you need.